Good morning, everybody. Thank you for coming to South Nassau for our Advanced Go Red Women's Heart Health Day. We're celebrating a day early, but we want to welcome everyone. We have two very important people here today, Dr. Pilar Stevens-Cohen and her amazing patient, Heidi Farkas, who's from the community. She's from Woodmere, and she was a patient here, a very grateful patient of the doctors and her team. So Dr. Stevens is a clinical cardiologist in our Center for Cardiovascular Health. She's recognized as one of New York's leading cardiologists and an expert in non-invasive cardiology and clinical cardiac echo. She treats a range of conditions from cardiovascular disease and heart failure to atrial flutters and acute myocardial infarction. Okay. She's noted for her use of cardioversion and technical advances in the field of cardiology, enhancing typical recovery times and maximizing outcomes for all of her patients. And we're so happy that she's here at South Nassau, and we welcome everybody here. The doctor is going to do a short presentation, speak with Heidi a little bit, and then if anybody has any questions, we're happy to listen to them. Thank you.
Thank you. Okay, so welcome to South Nassau. I'm going to talk a little bit about the national campaign, Go Red for Women. And I see everyone's in red. We typically wear red. The red dress is our national symbol for women and heart disease awareness. And the campaign started a few years ago, supported by American Heart Association, and entitled The Heart Truth. And it was really designed to help educate women, particularly women ages 40 to 60, to understand what their risk of heart disease was and to help take action to learn how to protect themselves from heart disease. The truth is that heart disease is the #1 killer of American women. It kills more people than cancer, all types of cancer combined. And it's funny, they've done this in a few ways, a couple of studies, surveys, interviews, asking women what they fear the most. What do they think they're most likely to die of? And #1, universally, the answer is cancer, and particularly breast cancer. It's everyone's biggest fear. But heart disease actually is the #1 killer. And if it doesn't kill you, it can permanently alter your life. It can damage you, it leads to long-standing complications, including heart failure, and it can severely affect your future. The fact is that 1 in 3 women in the United States is diagnosed with some form of heart disease. That number is expected to increase as obesity increases, diabetes increases, and patients are living longer and longer. So the evidence is now there and clear that this has now become a global health issue. Over 6 million women in the United States have a diagnosis of heart disease, and 2/3 of women who die from a sudden cardiac death never have a recognizable symptom prior to that event. It's even worse in minority communities. Over 20,000 African American women die each year from heart disease. 50% of African American women over the age of 40 have underlying heart disease. Despite that, only half of them know what the actual risk of heart disease are, what the signs and symptoms are. 1 in 5 know what their personal risk is. And it's because women present a little bit differently than men. They don't have the typical chest pain, clutching your chest, radiating to the jaw, down the left arm pain. It can be very subtle: shortness of breath, chronic fatigue, breaking out into a cold sweat, nausea, vomiting, lightheaded, dizziness. So you have to have a very low threshold for investigating heart disease in women. Learning the warning signs is important. Early intervention. We've all heard horror stories of patients driving themselves to the ER, having a cardiac event or an arrhythmia en route because they don't call the ambulance. So there are certain things that we need to do to educate the community on how to protect themselves and how to get immediate help. So we focus on women because historically, the studies don't include us. Most of the studies on acute myocardial infarction, the treatment, early stent, intervention, stress testing, include men over the age of 50, white men over the age of 50. They don't include women, and they certainly don't include minority women. So while we have this awareness campaign and we've had improvement, we certainly have a long way to go. The good news is that a lot of heart disease can be prevented or controlled. We have lifestyle modifications, we have risk factor reduction scores, we have things that we can do to decrease our personal risk of having heart disease. So we typically break up our risk factors into modifiable risk factors and risk factors that we can't control. So some things we can control: smoking, obesity, which is directly correlated to type 2 diabetes, our physical inactivity, metabolic syndrome, having high cholesterol untreated. Things that we can't control: family history of heart disease. As much as we fight it, we can't control our age. Having history of hypertension or diabetes during pregnancy. We've studied those populations of people, and we know that having hypertension or diabetes during pregnancy puts you at higher risk for having it after. Other risk factors that you can't control or we can modify: birth control pills, anemia, having an unhealthy diet, sleep apnea, alcohol intake. We have this thing called the multiplier effect, where having one risk factor for heart disease doubles your risk of having heart disease. Having two risk factors quadruples your risk, and 3 or more can increase your risk for heart disease by up to 10-fold. So just by doing 4 things, picking 4 things, eating right, being more physically active, controlling your blood pressure, you can lower your personal risk of heart disease by as much as 80%. So what do we need to do? Women need to talk to their doctors, have a list of questions, get tested and screened, learn what your personal risk for having heart disease is, and the things that you can do to modify them. Having your blood pressure checked, cholesterol, diabetes screening. Being a minority, being an American woman is now an independent risk factor for having diabetes alone. And you need to be screened more often. Knowing what your body mass index is, even if your BMI is within normal range, having an increased waist circumference increases your risk for heart disease. And when appropriate, EKGs and stress testing can be helpful. You can start today. AHA recommends 10,000 steps a day, right? 30 minutes of moderate activity, light to moderate activity 5 times a week can decrease your risk of heart disease. Some of the resources you can go to, in addition to American Heart Association, to learn the hearttruth.gov, womenshealth.gov, womensheart.org, all powerful resources to kind of learn about some of the things that you should ask your physicians when you go to your doctor's appointment to decrease your risk for heart disease. And it's up to us to protect ourselves, educate ourselves, know what our risk is, and live a healthy life. Thank you.